Well, so I think a couple things. One is we're going to do 60 plus starting on Monday. We think that that'll go well. The infrastructure that's in place now is fantastic. At the end of December, when we were doing Seniors First, we didn't have any retail pharmacies. There was no retail pharmacies that you could get it for at all. We were doing it primarily through hospitals, started to expand it to county health departments. Hospitals did a really good job, but I mean, they just weren't used to having hundreds of thousands of people crash on their system. Some of the counties weren't ready for that. We've obviously helped augment that with some state support for there. So I just think we're in a much different situation than we were there. But that's why we're doing the age gradually, because the 60 to 64, that's between 1.5 million and 1.9 million additional Floridians. Now, not all of them will want it, but a big chunk of those are going to want it. So you want to go through, do it. We have much more doses on a weekly basis than we did 2 months ago. Then you do the 55, and you get the sense of that. And then I'm pretty sure sometime in April, as long as the supply keeps coming in good and hopefully increases with J&J, then you'll be able to do it and say, you know what, any adult who wants it can get it. I'd be willing to bet you that the interest in it from people that are, say, under the age of 40 will be much less than it was with the seniors. I mean, we had seniors that were waiting for this vaccine for a long time. It was a big deal. I mean, I've gone to so many of these places where we've been able to bring vaccines to seniors, and it's a very emotional experience for a lot of them. I mean, because they've been waiting for this, so finally get that shot. You know, they feel like that it just gives them that confidence to really be able to live full lives again. And I know a lot of seniors have been doing a lot of good stuff in Florida. They haven't necessarily been just sitting at home all the time, but they've been cautious, and now to have that. So it's a really, really big deal. I think as you get into some of the younger demographics where the risk is just a lot lower, I think it's going to be less than 50% are going to opt for it. And in fact, we got a little bit of a preview on that. When we brought it to the hospitals, we did the frontline healthcare professionals. You know, a lot of the nurses chose not to do it, particularly the younger nurses. That was their choice. And so I think you're going to see something similar. I think you'll see a majority of people 55 and up will ultimately want it, but I think below, say, 45 or 40, I think it'll be less than a majority will ultimately want it. But here's the thing. If we want to increase the vaccination rates, you can't tell people that you got to wear masks for the rest of your life. You got to tell them, get the vaccine so you can live normal. And I think some of the messaging has just been so destructive to try to get people to want to do it. Why would they want to do it if there's no benefit for them? And when they say that, oh, you may be able to have a couple family members over for July 4th, I mean, what? We've been doing that for over a year in Florida. I don't understand kind of some of this messaging. So I think we're going to be in good shape as long as the vaccine continues to come, as long as we get the anticipated increases. We've got a tremendous infrastructure. I mean, I mentioned the pharmacies. We have 730 Publix, I think, that have it now. CVS, we've expanded, but we could do a lot more with CVS. And so as the doses come in, boy, I think there's over 1,000 CVSs in Florida. So just imagine that in all these communities. It'll be very easy for a lot of people to get shots. So we're excited about it.
Some states have waiting lists. Some states have a central website where everybody can go and get their name on the list, even if they're not eligible yet. Is that something Florida can do?
So what we try to work it. So the state isn't the one that is, you know, we have different ways of doing it. And so ours is a more decentralized approach befitting a really big state, very diverse communities. And so what we have is obviously the hospitals were the first game in town. We have the county health departments. Some of them have done waiting lists. We have the retail pharmacies, which are really expanded, but that is not signed up on a government list and then transferred. You got to sign up on that directly, and that makes sense because you certainly don't want the government involved in that. We've done a number of events with church groups. We've done a lot of African American churches. We rely on the churches to reach out to their parishioners and bring folks in, and it's more effective that way. So again, that's not taking them off a government list. That's working with the community and saying, who do you want us to vaccinate? We'll do it. Same with the senior 55 and up communities. You know, when we're down in Kings Point and Delray Beach, we're working with them to notify their folks, roster them, and then do it so it makes it easier for different folks. And then we also are now getting it in physicians' offices, and then we're getting it in some of the health plans now have this. So a health plan is great because they have people that they service on a normal basis. So say Monday we have 60 plus. A health plan can reach out to some of their members and say, okay, you want to come in and get the vaccine, you do it. So it's a very orderly process, and I think it works very, very well. So that, I think, is better than trying to have it all centralized in the government and have the government be the one that is dictating all these appointments. Because the fact of the matter is, a CVS or a Publix or a hospital or some of these people, they do it better than the government does it, and we want to leverage the existing resources. So we made that decision from early on. I think if you're a different state, if you're a very small state with, instead of having 22 million people, if you have 1 million people, you may be able to do it a little bit differently. But for our situation, with the big senior population, with the seniors really spread out all over the state, massive geography differences, we feel that this has been the most effective. And look, I think the results speak for themselves. We've done millions of seniors. We're either number one or close to the top of the percentage of all vaccines that have gone to seniors, the total number of seniors vaccinated, and then the percentage of all seniors that have been vaccinated. And so it's taken, I think, a real multifaceted effort, and we're going to continue to do it. And as the 60 plus get in, we're looking forward to a lot of those folks being able to get the vaccine. I think you'll see hundreds of thousands of them over the next week that are going to be eligible, will likely be able to get it. We're also going to be making sure that if there are some of those very elderly people where we have a new way for them to contact us for the homebound program, we're very attentive to that because we understand that's going to continue to be an issue because not everyone has necessarily the internet or can do the phone calls or any of these other things. So if there's someone homebound, and we've done Holocaust survivors, we've done World War II veterans, we've done a lot of these really special people, and we want to continue to be able to do it. But I think next week we will have a good sense as we see the demand when we can maybe even lower that age even more. We'd like to make that decision next week sometime. I'm not saying it's going to happen effective next week, but I'd like to be able to make that announcement by the end of next week, get it down to 55. And I'm pretty sure by the time March is up, we will have all 55 and up, no questions asked. And then surely some point in April, depending on demand, I think it'll be open to all adults who want it. And so that's exciting. And I think that's, if we were here a year ago, remember they were saying vaccines take years to do. No one, all these guys, all these experts were saying you couldn't do it, it wouldn't happen. We're in a position where we may have 2/3 of our seniors done like on basically a year after the whole pandemic was declared. That's pretty incredible. I think it's a testament to America and a lot of the ingenuity that we saw with Operation Warp Speed.